Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I have the pleasure of talking with Dr. David Winston, who is a renowned herbalist and ethnobotanist with 56 years of training in Chinese, Western, Eclectic, and Southeastern herbal traditions. Today, we're talking herbal formulations for common ailments, safety practices using botanicals, resources for herb medication interactions, and so much more. So stay tuned. Hello, everybody, and welcome to another episode of the Smart Human Podcast. Today, I have the pleasure of talking with David Winston, who is an herbalist and ethnobotanist with 56 years of training in Chinese, Western, Eclectic, and Southeastern herbal traditions. He has been in clinical practice for 49 years and is an herbal consultant to physicians, herbalists, and researchers throughout the USA, Europe, and Canada. He has also received countless awards and recognition. Dr. Winston, thank you so much for being here today.
Oh, it's a pleasure, Ailey. I'm really happy to be here.
Oh, gosh, I have so many questions I can't even begin to tell you. And I'm sure the listeners who may or may not be familiar with herbal medicine are really going to be hopefully anxious to hear what we have to talk about. So I'm going to keep my questions very simple and direct and try to really pull out as much wisdom from you as possible. First, I want to start with, very simple. What is an herbalist? And I just said to you earlier, herbologist, and you said there's no such word. So there you go. What is an herbalist? Explain that to me.
Well, the challenge of a definition sometimes is that an herbalist could be multiple things. I'm a clinical herbalist. So as a clinical herbalist, I practice herbal medicine. Now, the idea of an herbalist, you could have somebody who harvests herbs and uses themselves and might call themselves an herbalist. You have people who are wild crafters who are harvesting wild herbs who might consider themselves an herbalist. But because of that somewhat lack of definition, I would say in general, an herbalist is someone who uses herbs in a medicinal way. Clinical herbalists, and for the most part, when you're looking for clinical herbalists, you're looking for somebody who has initials after their name. The initials are RH, or it may say RHAHG, which means they're a professional member of the American Herbalist Guild, which is the only organization that certifies clinical herbalists in the United States. We also work in Canada. And so the idea is these are people who have extensive background, extensive training. We're not physicians, although we have many members in the American Herbalist Guild who are also physicians, who are also licensed acupuncturists, who are also naturopathic physicians. But an herbalist is someone who has studied extensively, understanding both herbal medicine, but the foundations of medicine, of course, anatomy and physiology and pathophysiology and all of the foundations, you working with herbs to enhance overall human health and as well as to help people get well and stay well. I would just say one of the differences between an herbalist and a physician is that as herbalists, we are not allowed to diagnose or prescribe, but we are allowed to help people be well. And so based on First Amendment rights, and somebody comes to me, I'm not going to diagnose them with something, but when they come with a diagnosis, I can help create protocols that allow them to regain their health. And the idea within naturopathic medicine is what they call vis medicatrix natura, the healing power of nature. And a lot of people have this idea that there's this sort of battle. There's herbal medicine or complementary alternative medicine and orthodox medicine. And I'm sure most of your listeners understand because they're listening to you and they know what you're talking about and what you do. Is they're not actually antagonistic at all, because where orthodox medicine is strong is exactly where herbal medicine is at. Basically, it's its weakest, and the obverse is true. Where herbal medicine is its best is where orthodox medicine is not very good. And so the reality is, when it comes to the patient, the win-win is having a great herbalist working with a great physician, because while there is some overlap, what each of us does is really a different thing. And so the idea is not focusing in as an herbalist when, somebody comes with depression who's been diagnosed with depression. I'm more interested in not the depression, but I'm interested in the person who is depressed. And as an herbalist, we look at 14 different subtypes of depression, each one with their own unique treatments and protocols rather than the generic depression. And that is one of the reasons, at least in my opinion, in my clinical experience, where herbal medicine in some cases can be so much more effective. Instead of treating a condition or a disease like depression as a single entity, we actually look at, why is this person depressed? Is it a GI issue? Is it a cardiac issue? Is it a thyroid issue, et cetera? And so, again, herbal medicine is the oldest medicine on the planet, and it is still incredibly effective.
That's, really interesting, because as an integrative medicine trained doctor, we're trained to think about all these other avenues of healing, all these other tools. And you're one of the most widely respected. You started a botanical safety handbook. You've been on advisory committees. I think you were the founding professional member of the American Herbalist Guild. You've had so many recognitions, and you've had so much in the way of research to create guidelines for other herbalists. So when you brought up depression, it made me, I had a question about, to your point, doctors will often prescribe medications, Western medicine. But then there are also patients that are running out for St. John's wort and some of these other more commonly known herbal therapies. What do you say in terms of the dosing, in terms of the management, and how do you decide with the patient how much is the right amount, how often, and whether or not that mixture of, say, pharmaceutical approach could be harmful or really synergistic in a beneficial way?
Well, it's kind of interesting. I'll tell you a quick little story. Back in around 1995, then I started studying herbal medicine in 1969. And at the time, people would say, "What are you doing?" I'd say, "I'm an herbalist." People would look at me like I just told them I was an alien from another planet. It was like, what? It was just so far out in left field. It was an entirely different stadium. Anyway, around 1995, all of a sudden, there became a certain popularity of herbs in herbal medicine and a certain cachet. And I was getting 2, 3, 4 phone calls a week from physicians going, I'm kind of interested in herbs. And as I think most people are aware, the popular media tends to, if something gets really, everybody jumps on a bandwagon, there's almost inevitably this pendulum swing. And all of a sudden in 1998, after about 3 years of almost unrelenting positive stories on herbal medicine, all of a sudden the pendulum swung, and all of a sudden we're seeing all these negative stories. Herbs are dangerous and herb-drug interactions. Now, that is not to say that herb-drug interactions, which you just sort of mentioned for a moment, it's not that they don't happen. They do. But the reality is clinically significant herb-drug interactions, meaning they can cause a real problem, are really quite rare. And they mostly occur with 7 medications, some of which are not all that commonly prescribed, like something like warfarin, which used to be commonly prescribed, but now is more and more being replaced by other medications.
Blood thinner.
Yeah, it's a blood thinner. Now people are more being given things like Eliquis, which is a safer blood thinner because warfarin interacts not only with certain herbs, but foods, other pharmaceuticals. It's sort of the nightmare of drug interaction medication. So anyway, the reality is that, for instance, if somebody came to me who's on a pharmaceutical medication, let's say they're on SSRI, which is one of the more common antidepressant type medications. As an herbalist, it is not my place to, number one, to tell somebody not to take that medication. That's between them and their physician. I think, we all need to know our lanes, and we all need to know our, limitations of practice and certainly our limitations of knowledge. So if somebody's on an antidepressant and it works for them, that's fantastic. Keep doing it. That's wonderful. But the clinical trials show us that pharmaceutical medications work about 40% of the time. It's not that impressive, honestly speaking. And in fact, St. John's wort, which you also mentioned, if you take that for depression, it works about 40% of the time. So, it works as good as antidepressants, but placebos work 33% of the time. So that, again, 7% better is better, but it's not that impressive. And again, when you get down to the point of treating the person who's depressed rather than depression, I would say that many clinicians are getting results where they're getting 65, 70% of the time they're seeing really positive results because, again, they're treating the person rather than this entity of depression, which can have so many underlying causes, as, of course, you are well aware. So now, when we talk about St. John's wort, which you brought up, if we are talking about, herbs that can cause herb-drug interactions, St. John's wort's the poster child for herb-drug interactions. St. John's wort has been shown to potentially cause interactions with drugs like cyclosporin, which is an anti-transplant rejection drug. There are cases people taking St. John's wort, they started to reject the heart. Yeah, you don't, that's terrible. We certainly do not want that. I would also be rather cautious combining St. John's wort with pharmaceutical medications because there is at least some evidence that there's an increased risk of what's called serotonin syndrome, which is a really significant, potentially life-threatening interaction that can be caused by SSRIs all by themselves, but St. John's wort may increase that potential. And so, as a herbalist, number one, when somebody is coming to me, I need to look at the person. I need to look at, for instance, if they are on medications. When I first started practicing, if somebody would come to me who was in their 70s or 80s, they might have been on maybe digoxin, a heart medicine, maybe a diuretic, but that was usually about it. Now, if I see somebody that age and I ask them what medications they're taking, every once in a while, somebody will say to me, oh, I'm not on any pharmaceutical medications, but that is so rare. That is so rare. My current record is a patient who was on 17 different pharmaceutical medications, some of which were used to deal with the adverse effects of some of the other ones. And when you're going into a situation like that, you have to be incredibly careful.
Right.
Because, again, it's not my place to, number one, take them off. If I see that they're on a combination of medications that I know is problematic, then I will have them go back and suggest they speak to their doctor or speak to their pharmacist about that, because again, that's out of my realm of training and in what I should be dealing with. On the other hand, many herbs, my Aunt Edna used to say, and she was one of my early teachers, Aunt Edna used to say that herbs affect people in one of three ways. They're either a food, a medicine, or a poison. So our food herbs are not only things that people already think of as foods, like blueberries and garlic and onions and
mushrooms
cinnamon and ginger, but it's also a whole range of mild, pretty benign herbs, things like lemon balm and hawthorn and peppermint and chamomile. So the food herbs are generally safe. They can be taken in reasonable amounts. And when I say reasonable, ginger is safe, but I would hope none of our listeners are going to eat an entire bowl full of ginger. A little bit of ginger, for instance, is wonderful for nausea. But if you take too much ginger, it can give you nausea. So Americans seem to have these ideas, for instance, that herbs are natural, so therefore they're all safe.
Right.
Well, no. Aconite is natural, and belladonna is natural, and datura is natural, and they'll all kill you if you take them and are not,
And pregnant, right? If you take too much ginger, it's actually promotility? Not as much?
Ginger, you said about pregnancy?
Yeah, if you're pregnant, I was always concerned whether or not ginger was promotility. Am I thinking of that, or am I thinking of peppermint oil and peppermint?
Well, the thing about ginger is in Chinese medicine, ginger is known to move blood, enhance circulation. So the theory is, at least in TCM, that you don't give a lot of ginger to a pregnant woman.
Yeah.
Except that there are clinical studies done over the last 30 years showing that ginger had no negative effects on pregnancy whatsoever. On the other hand, would I have a pregnant woman drink 6 cups of ginger tea a day? No. Right. But to have a pregnant woman drink a combination of mild, benign herbs with a little bit of ginger in there, especially if she's having some morning sickness because it has antiemetic, anti-nausea activity, would be totally appropriate.
Yeah. No, these are the things you said TCM. I wanted to tell the audience it's traditional Chinese medicine. So there's all these crossovers of some of the, early information on this, but what funnels down into clinical practice often, as you're saying to me, is a matter of dose and moderation in terms of how much you would take of that particular amount. So, what you're really saying is that there are ways to, again, synergize a current condition, but there's also, aren't there substitutes within herbal medicine that could do just the same as pharmaceutical medications? I'm thinking like red yeast rice instead of statins, licorice root, like deglycerizing licorice, like DGL versus, Nexium. Are there, is that kind of one of the roles that an herbalist might play in modern day times where you're talking about polypharmacy and people coming in with 20 different medications? Is that something that you would help assist with in a safe and reasonable way? Or is it something you might discuss with their practitioner? How do you go about doing that and discussing that?
Well, again, if someone comes in and let's say they are on an H2 blocker or a PPI, these are the medications that reduce stomach acid. And the FDA came out with a black label warning about 10 years ago, telling people that these H2 blockers, which are available, by the way, over the counter as well as prescription, the H2 blockers and the PPIs, people should be on them for the shortest period of time possible and at the lowest dose possible. I've had patients come in who've been on them at high dose for 10 years. And these people come in with overt deficiencies, B12 deficiencies, iron deficiencies, magnesium deficiencies, and the list just goes, vitamin K deficiency. The list just goes on, because the funny thing is, stomach acid is there for a reason. It helps us to break down our food so we can absorb what in Chinese medicine is called the gu qi, the grain qi, the nutrients. And so if you're taking something that either mostly inhibits stomach acid or totally inhibits stomach acid, yes, you don't have heartburn, although it would let our listeners know that the symptoms of too much stomach acid, heartburn, are the same as too little stomach acid, heartburn. And the majority of people who are taking those medicines do not have too much stomach acid. They actually have too little stomach acid. And so, those medications are really problematic. So yes, taking something like DGL licorice, which basically there is a chemical in licorice that can cause what is called a pseudo-hyperaldosterogenic effect. What that means is it causes you to retain sodium and excrete potassium. Thus, your blood pressure can go up, and it can also increase risk of things like arrhythmias, cardiac arrhythmias. So therefore, something like a DGL licorice, which comes in chewable tablets, and it is, even if you say, oh, I hate the taste of licorice, it doesn't really taste like licorice. It just tastes vaguely sweet.
Well, you can get it in chocolate flavor too. We have it here.
Oh,
yeah.
See, I learned something new.
Yeah, so I hate licorice.
Chocolate DGL.
but the poison and the chemical you were talking about, just to be clear, is the glycyrrhizin. So the DGL stands for, the acronym is deglycyrrhizin licorice. So people are unclear on that, and it's not proprietary to any company. So a lot of different companies make DGL in different formulations and different flavors. Okay,
different flavors. I knew there was one out there that had orange flavor, but I didn't know there was a chocolate. So for all of you chocolate lovers, there you go, a new source of chocolate in your diet. So the thing is, that can be a reasonable substitute, but that's using herbs rather allopathically. So as an herbalist, my focus is more, I certainly can do that, and I'm happy to do that. If a physician I work with, I act as a consultant to probably 100 physicians, more or less, give or take, around the world. If somebody calls me up and says, hey, we wouldn't want to replace this medication, what do you think? And I can say, sure, you could try this, you could try this. And I would point out that red rice yeast, for instance, is not going to do what statins do. It's much, much milder. It doesn't have the same level of efficacy, but for some people, it's certainly adequate, and it's less likely to cause adverse effects that statins do. But as an herbalist, I'm more interested in looking at the person and looking at what I would call first off, we look at the foundations of health. Herbs are not foundational. Nobody ever got sick because of a St. John's wort deficiency. So the foundations of health, which as a complementary alternative physician, whatever you want to call it, integrative physician, you would do, or a naturopathic physician would do, or as a clinical herbalist would do, is first we look at the person and we look at the foundations of health. Diet. Do they have a healthy diet? And of course, Americans have some very interesting ideas about what a healthy diet is. If it's extreme, it's not healthy. I can tell you that right off the bat. And if people want to know probably the easiest, basic healthy diet, focus in on a Mediterranean diet. It's, there's tons of research on that diet is a pretty healthy diet for the average person. Secondly, sleep. Sleep is foundational. And it's not just, often when somebody goes to a clinician, they'll say, well, how many hours a night do you sleep? And they say, oh, 8. Oh, good, good. That's the wrong question. The question is, when you wake up in the morning, do you feel refreshed? So I don't care how many hours of sleep you're getting a night. You can be in bed 10, 12 hours. And if you wake up and you feel exhausted, something's wrong.
Right.
And maybe you need a sleep study. You go to your doctor and, get a prescription so you can get a sleep study done. But you might have sleep apnea, might have sleep hypopnea, you might have restless leg syndrome, you might have periodic limb movement disorder, or any number of other dysomnias that interfere with sleep. But sleep quality is essential. I mean, among other things, when you're in delta sleep, and if you have sleep apnea, which is very common, you snore. If your partner tells you you snore, or you wake yourself up by snoring, the chances of you having sleep apnea or sleep hypopnea, which is sleep apnea light, is really high. If you have sleep apnea, you're never going into delta sleep. And during delta sleep, your brain actually shrinks 2 to 3% and is washed by cerebral spinal fluid. This is called the glymphatic system. We only discovered this 15 years ago.
I know, right?
And that's basically when the brain washes away things like beta amyloid and tau proteins, things that cause Alzheimer's disease. So sleep is absolutely foundational. And then little things like, exercise, exercise is foundational. Healthy lifestyle choices. I'm sorry, if you smoke cigarettes or vape or any of the other, I always get people wanting to know, well, what herb can I take to reduce the effects of smoking? Yeah, herbs don't really, yes, there are things you could take that probably reduce some of the adverse sequelae of smoking cigarettes, but you're doing something really bad to your body. And
not the chemicals. You can't really reduce the chemical load that you're getting, but in terms of anything else, oxygenation and circulation, I don't know. Yeah.
It's just bad.
It's just bad.
It's just bad. So, healthy lifestyle choices, stress reduction techniques, good relationships, these are the foundations of health. And this is sort of the area that you and myself and NDs and lots of people who are sort of seen as quote unquote alternative, although I don't really think of it that way. That's the starting point. That's where you start.
Right.
And then we use herbs to look at, all right, so let's say, going back to the depression example, studies over the last 10 years have found that an awful lot of depression has its basis in neuroinflammation. So you can take all the SSRIs or SRNIs that you want. None of them reduce neuroinflammation. So ultimately, they're not going to be very effective. We also know that gut inflammation is directly tied to neuroinflammation. So therefore, instead of treating depression, I may be focusing in on treating somebody's gut and reducing inflammation in the gut, and thus also reducing neuroinflammation. And gee, isn't it funny that their depression also happens to improve?
I love that you got to that, because so much about the gut pertains in integrative and even functional medicine. But when you hear it from a perspective of herbal medicine, I find that really important, because you hear it coming now in from a lot of different areas of medicine and therapy. I have a question for you in terms of your history of being an ethnobotanist. First of all, what is an ethnobotanist? And the second question is, how do you bring that into the sort of the safety and efficacy of some of these herbal medicine therapeutics? How does that go in terms of randomized trials? And how does that play in terms of the overall oversight in terms of safety in the United States?
Well, the ethnobotany is the science of people's use of plants, both for food, for medicine, for economic uses. And I've always been fascinated by that. And so I've spent a good part of my life. My aunt was a traditional herbalist in North Carolina. My uncle was a traditional healer. And so I was fascinated by that. And so ethnobotany is the study of that.
Mm.
And again, there's ethnobotany of various cultures around the world, their use of plants, because so many plants that we are using today, we didn't just kind of out of thin air say, oh, that plant looks interesting. Let's try using that. No, actually, that has happened. Things like ginkgo. Ginkgo, you hear ginkgo leaf is traditional Chinese herb. Absolutely not. There's no history of use of ginkgo in China. Ginkgo seeds were used as a food and medicine after being detoxified. But ginkgo leaf is a modern phytopharmaceutical that
Huh.
was discovered by a company in France doing random drug screenings looking for interesting compounds in plants. That, though, is really atypical. That is really unusual phenomenon. Most plants have been used not only for hundreds of years, but thousands of years. And so when we look at plants like turmeric, which is
Hmm.
really popular, or we look at plants like saw palmetto, or we look at things like, I don't know, golden seal. These plants have been used for millennia by native indigenous people around the world. And there are long histories, and in some cases, really established traditions. We talked about traditional Chinese medicine, TCM, which is 3,000 years old. Our Ayurveda from India is actually even older. It's over 3,000 years old. We have Kampo from Japan, which is basically a version of Chinese medicine. We have Siddha from South India and Sri Lanka. We have Tibetan medicine. Then we have systems that came along later. What a lot of people don't know is in America, there were herbal MDs practicing from the 1830s through the 1930s or 40s in the United States. These were licensed MDs who were herbalists.
Mm.
They were, one group was called the Eclectic physicians, and the other group were called the physiomedicalists. And they left us a rich literature of clinical use from over 100 years of clinical experience that I have most of these books in my library. And so these traditions around the world, some of them like the eclectic and the physiomedical traditions died out, but other ones like Ayurveda and TCM are still going strong. And one of the things people often talk about is, well, herbs are not studied. There are herbs that are not studied, but almost any herb you have heard of has a lot of clinical data on it. There are, first off, probably in vitro studies, which is in a test tube or petri dish. There are animal studies. And for most of them, there are human clinical trials. And so, for me, the best of herbal medicine, a lot of people, again, have this idea that I think we tend to like to this idea of dichotomies, that things have to be black or white. I just don't think that way. And so for me, the idea, and this is true in the herbal community as well, a lot of people think it's either got to be all scientific or it's got to be all traditional. And there's no meeting of the two. Traditional knowledge is a way of not knowing. It's a way of knowledge. It's in a way of showing efficacy. I am all for traditional knowledge. And I am also totally interested in clinical driven data. All right. So for me, science and tradition go together, and the information that comes out of those, especially when they are used in conjunction with one another, is far superior to either one. And so, for instance, I'll give you an example. I mentioned turmeric a moment ago. And most people have heard of turmeric. Turmeric is really, it's very hot in the marketplace.
Hmm.
But a lot of people think that the active ingredients in turmeric is a set of compounds. There's 3 of them called curcuminoids. And so
Right.
people will talk about curcumin. And by the way,
Hmm.
there is a ton of research on curcumin. But
Tons.
the irony is that the researchers doing the studies often don't actually know the difference. And you'll see a research paper, a clinical trial, and it'll say turmeric does this. But then you read it, the whole paper, and you realize they weren't studying turmeric, they were studying curcumin,
Right.
or vice versa. Well, Since they identified, and one of the reasons the curcuminoids were identified as the quote unquote active ingredients in turmeric is you could patent them. You can't patent turmeric. Anyway, since they identified these three compounds, the curcuminoids, as the active ingredients in turmeric, researchers have identified an additional 15 to 20 active ingredients in turmeric that aren't in curcumin. And in fact, a study done about 7 years ago showed that a curcumin-free turmeric extract, they took all the curcuminoids out, had just as much anti-inflammatory and anti-tumor activity as did curcumin. So I'm not saying curcumin doesn't work, but curcumin is poorly absorbed and quickly excreted. So then you have to mix in other stuff like black pepper extract called bioperin, or phosphatidylcholine or micelle, something to get it into your body and to keep it in there for longer. The irony is, in whole turmeric, there are chemicals in there that increase the absorption of the curcuminoids without adding anything. And clinically, and I've tried all sorts of curcumin products out there. Have I tried all of them? No, absolutely not. There's probably hundreds of different products in the marketplace. I get better results using turmeric as a tincture of the whole turmeric, the root. A tincture is an alcohol and water extract. Right. I get better results using turmeric as a tincture than I've gotten using any curcumin product on the market that I've ever tried.
That's interesting. And, I think your point is well taken in terms of just the traditional. I get that idea that, it's passed down through generations and through textbooks and previous practitioners. I think what I've often contended with is that we've had this really rich body of therapeutics prior to modern day times. And then you're adding in, thousands of environmental chemicals, polypharmacy and different pharmaceutical mixtures. And I think that's where the question of rigorous, scientific study comes up, is how do you mesh those two worlds of all this beautiful information with modern day exposures? Does that contribute to this sort of soup that we have in our body where we don't know all of the effects? And I'm not asking you to fully answer that question entirely, but, I think that's where, we're starting to see potentially liver issues, cases of elevated LFTs with turmeric, curcumin in commercially, marketed brands. And which goes to the question, and I've read those studies, and it seems that it's not just the quality, which I'd love you to address in terms of how do you suss out the quality, but also the way in which people take them, where they're taking so much of a supplement over a longer period of time, or even a reasonable amount over a longer period of time than they should be taking it. That seems to be getting some people into trouble, particularly liver function enzymes. So, can you speak to that issue of quality, quantity, how long people use them? Should they be tested and have periodic liver function tests and metabolic, basic blood work to evaluate how all these things combine and mix?
Well, turmeric is a really interesting example because whole turmeric is hepatoprotective. And so it's used to treat liver damage. There are numerous clinical trials showing that turmeric reduces NAFLD, non-alcoholic fatty liver disease, NASH, steatohepatitis, various types of hepatitis A, hepatitis B, hepatitis C. And yet, as you mentioned, there are these small number of cases with hepatic damage, which seems a bit contradictory. So there's a couple of things that need to be thought about. Number one, most of the cases of liver damage are not with turmeric, they're with curcumin. And probably half of the curcumin in the marketplace is synthetic, not derived from turmeric. It is a petrochemical. So then, and they've never looked, nobody's ever sat there and said, oh, well, maybe if this is the problem. And I'm not saying it is, I'm saying that could be a problem because I can guarantee you, synthetic curcumin is not identical to natural curcumin, nor is curcumin the same thing as turmeric. So that's one problem.
Can you see that on a label as I'm thinking of it? So there's no way as a consumer to identify that particular issue?
No. Well, I would say one of the things is go with brands that are really well known and trusted. I think that that's much less likely to be a problem than some brand you're buying off the internet that you've never heard of, but it's cheaper.
Brands
So
matter.
that
Yeah.
would be one thing. Number
Yes.
two, when they extract the curcuminoids, what do they use to extract it? Some of the chemicals they use are things like hexane. They are not nice chemicals and they are hepatotoxic. I have been in factories where they get these 55-gallon drums of curcumin powder, and you open the lid and you can smell the hexane off gassing from the product.
Mm,
The FDA allows for up to 3% of hexane residue in a finished extract. That may be an issue. In addition to that, then the question is, how was it grown? Was it grown organically, or was it
right.
grown using synthetic fertilizers and pesticides and herbicides and glyphosate and all these sorts of things? And if that's the case, are there any residues of that left in the product? I know there was a really good study done a few years ago on Chinese ginseng, and the amount of pesticide, herbicide, and fungicide residues in the products were off the charts. And so that isn't, I prefer my herbs to be unleaded personally. When I use herbs, I'm using herbs that are either consciously wildcrafted in places that we know are clean, as much as that is possible in the world we live in today, or they're organically grown. And so anything that is being commercially grown, that is an issue. And then the
Right.
last point I would make, as medicine evolves and we're starting to get into the realm of combining AI and medicine and the individual human genome and epigenetics, what we're starting to understand is, and we're not there yet, we're actually quite a ways away from that. But at some point in the future, I suspect they'll be able to take a scraping from the inside of your mouth, put it into a machine, and it will tell you which chemicals in the environment you react to, which drugs you're going to react positively
Mm,
to, which they can even do this now for like cancer treatment. A lot of times it's not done, but they can actually take a biopsy of a cancer and actually determine ahead of time whether the standard chemotherapy agents are going to actually have any efficacy against that cancer at all, because they're so unique to the person who has them. It's expensive, and so a lot of times it's not done, and you just get quote-unquote standard therapy. But they could do it, and what they
yeah.
would often find out is the chemotherapy agent you're going to get will never work for your version of that cancer.
And spare so much side effects and all of the things that go along with getting hardcore chemotherapy, which is
Organ
really
toxicity,
right.
all
Mouth
sorts of things.
sores and, weight loss and
Exactly.
cachexia. But also they're going to be doing that with rheumatologic drugs, I hope, because that's a whole nother area where they could potentially take your blood or skin samples and try to identify whether you'd respond to a biologic or
Right.
some other medication before you go through trials and side effects. So yes, I
And
agree.
if
It's
that ever happens, if we ever get to that point, then that could be done with herbs as well.
yeah.
Because the last point I would make is that there are two phenomenon. Maybe we could call it three. One is allergic response. Anybody can have an allergic response to anything. Any herb, any food, any pharmaceutical, any cosmetic, clothing, jewelry, you name it. The environment, I've met people who I swear are allergic to life. So that is possible. And we have to take that out of the picture in the sense of talking about herbs in general, because, yeah, there is like one case of somebody taking chamomile tea who was incredibly allergic to ragweed. And because of the similarity of ragweed pollen and chamomile pollen, they're in the same botanical family, they had an anaphylactic response and died. All right, that's one case. Millions of cups of chamomile tea are drunk safely throughout the world every single day. But allergy is a real phenomenon. And then the other one is the fact that, we're understanding, everybody's all excited about getting their, MTHFR gene SNP tested to see if they have methylation problems. Everybody has gene SNPs. Everybody. There's no one on this planet that doesn't have some genetic flaws. And the problem is that you could have, some genetic flaw that may be like, 1% of 1% of the population has. And for that 1% of 1% of the population, this drug or this herb is problematic because you can't metabolize it correctly, or you metabolize it in a way that creates secondary metabolites that are now potentially hepatotoxic. So that is the other side, and that's something that nobody can know because we're just not there yet. But what I would say, getting back to your question about quality, I think that what people do need to understand is that one of the things I always tell people is when you're buying herbs and herbal products, first off, is the company a company that has a really good reputation for herbs? I remember being at a trade show one time, and there was a company, and it was called, like, I don't remember what they called it, Blue Amazing Herbs. And they had 3 products, that's it. And only one of them was an herb. Another one was colloidal silver, and I forget what the other thing was. It's like these people, they didn't know anything about herbs. So, number one, is it a company that's been out there a long time that has a really well-established reputation and they know herbs? They're not a vitamin company that all of a sudden just decided to jump into herbs. They know herbs. They know how to source herbs. They know how to use the right part of herbs. So for instance, about 15 years ago, all of a sudden, kava became really popular. And kava is a really good muscle relaxer, anxiolytic, and people, additionally, there were no issues. And then finally, cases of hepatotoxicity start showing up with kava. And when they looked into it, they found out that there were a couple real problems. And the problems had to do with sourcing and had to do with manufacture. So number one, some of the manufacturers decided that the active ingredients in kava were these chemicals called kavalactones. Yes, they are active, but they are not the active ingredient. In fact, virtually no herb has a active ingredient or even a group. The whole herb has activity. And sometimes together, that creates the activity. So they started looking around and they realized that there was another variety of kava that people in the South Pacific did not use. It was called 2-day kava because it gave you a 2-day hangover if you used it. So they didn't use it.
Right.
But the manufacturer said, well, this has much higher levels of kavalactone, so we'll start using that. Well, number one, there was a long tradition of not using that plant. Then other manufacturers decided that the stem peelings, which were never used, it's the root, the stem peelings had lots of kavalactones and they were throwing them away, and it would be cheaper to make the product using the stem peelings. But it turns out the stem peelings have a chemical in them that is not found in the root that is potentially hepatotoxic.
Oh, geez.
And then lastly, they also found out that some of the roots were basically contained fungal aflatoxins, which may have been another. So again, it's like if you had harvested the root properly, there'd be no fungal aflatoxins. If you were using the right variety, you wouldn't be having a problem. And if you used the right part, you wouldn't have a problem. So this whole problem with kava hepatotoxicity primarily stems from greed and a lack of knowledge.
Yeah. And I think that goes across the board, to other components. I mean, we think about that in the food industry. We think about that in the cosmetic industry, cutting corners, cheaper compounds, not quite understanding the downstream effects and all of that. But interesting in herbal medicine, like, really what are the top 3 things to think about when you're choosing a company? You said a well-established brand, been around a long time, isn't doing 5 other different jobs at the same time. Any other nuggets we can glean from you in terms of just sussing out brands without sharing brands? Because that's not typically what I like to do.
I look for companies who have actually, well-respected clinical herbalists as part of their team.
So advisory board.
We have chemists, we have MDs, which is fine, great. We have this, but do they actually have any people who are like really well-known in the field of clinical herbal medicine? Because again, 2-day kava seemed like such a good idea, but all you had to know is the tradition that this plant was never used to say that's a bad idea.
Right.
And so in so many cases, that's one of the beauties of combining tradition with science is, yes, I want scientific research. Yes, I want to understand the underlying mechanisms of action. Yes, I want to see, human clinical trials showing safety and efficacy. I want all of that. But I also want the fact that this plant's been used for 3,000 years and, when it's used, and interestingly enough, I'll give you another example. There was a plant in the American marketplace called ephedra, ma huang.
Mm-hmm.
And ephedra was being used in the American marketplace to make people lose weight or as an herbal amphetamine. And it's a traditional Chinese plant. And if you go back to traditional Chinese medicine, ephedra has been used for almost 3,000 years safely and effectively. But it was never used to lose weight, nor was it used as a herbal amphetamine. It was used as a small part of a large formula for short periods of time for very specific purposes, mostly for acute congestion or people who had fevers with no sweating. And you mixed in other herbs to moderate the potential toxicity of the ma huang. And one of the herbs almost always used with it is licorice, which has been shown to reduce the toxicity of ma huang. So a lot of the, in these traditional systems, they have figured out, like in Chinese medicine, there's a practice called duiyao, and duiyao means two herbs. And in Chinese medicine, there are formulas. Nobody uses individual herbs. They're using complex formulas. And they basically build them in many cases to fit the specific patient. But they're made of the building blocks of duiyao. These are the herb pairs. There are 120 common herb pairs. And what people figured out over millennia is when I use herb A and herb B together, I get increased activity or increased safety or reduced adverse effects. And so there's this whole system created to do that. And so again, traditionally, we talked about turmeric, and everybody thinks turmeric and black pepper. The traditional formula is turmeric and ginger. Ginger enhances absorption of turmeric, and it can help reduce, again, some of the potential irritation and things like that. And so there are all these traditional combinations that create what is called synergy. And in herbal medicine, understanding synergy, you can take herb A and herb B, where sort of 1 + 1 = 2. And by properly combining herbs together, 1 + 1 no longer equals 2. It equals 3 or 4 or 5. I know one clinical trial where adding a second herb to herb A increased its bioavailability by 2,000%. So 1 + 1 = 2,000. But just throwing things together is not a guarantee of synergy, because there is the opposite phenomenon. We'll call it anti-synergy, antagonism, where 1 + 1 = 1. And so the good news is that is one of the reasons where, again, tradition is so important.
Right.
So much of the work has already been done for us.
So
Understanding that this herb and this herb
Yeah.
together is going to give you much greater activity, or again, reduce adverse effects, or, prevent nausea or whatever.
Right. And so to that point, when you see combination herbal or bottles of different combos, should that give us pause? Or, I've always thought, there's not enough of anything in any of these capsules with 20 ingredients to really do anything, that I'm a big fan of individualized supplements or herbal medicine or even drugs not being combination, because then you can identify and tease out whether there's side effects, whether there's benefit. How do you feel about these combo, herbals put together, herbal botanicals, so to speak, put together?
The answer to that is it depends. So one of my hobbies, I'll call it a hobby, I teach all over the US and Canada and Europe. And so when I go to a town, wherever I'm teaching, I usually stop off at the local health food store, natural foods co-op, because sometimes at like conferences and places like that, sometimes the food is not normally what I eat. So it's always nice to have a few things that I can, I don't have to, I've been to some conferences with just horrendous food. Anyway, So one of the things I do is I go into the supplement department and I pick products off the shelf and I look at them and I look at the ingredients. I can tell within less than 30 seconds whether that product was created by an herbalist or not.
How?
Because if it was created by an herbalist, the formula makes sense. And if it was created by somebody who just went on PubMed and put in the header migraines herbs, and anything that showed up positive, they threw together into a formula, assuming that, if one thing it works, more must be better. And again, I was talking about, Americans have this idea that everything's natural is safe. The other thing Americans tend to think is if a little bit's good, more must be better. Again, not true. Now, traditionally in herbal medicine, the use of simples, one thing at a time, is almost unknown. Polypharmacy is the norm in herbal medicine, but it's good polypharmacy, meaning these are tried and true combinations based again on things like Duyao, which are the building blocks of knowing what things work together and what things do not work together. But just throwing a bunch of stuff together in a formula can often turn out to be a lot of gray noise. And yes, you can be right. You can have a formula where there's just, I've seen some formulas sometimes, especially some Ayurvedic formulas, have like 50 ingredients. And the amount of some of the things in there are so minuscule, I really doubt that there's a whole lot being added by that substance. Nevertheless, there is this idea, again, that sometimes you get things, even small amounts of things, because as little as 3% of black pepper in a formula, it acts as a bioenhancer, can increase absorption of everything else in the formula by 30%. So sometimes a small amount of something, and there are other herbs that are known as bioenhancers as well, can be very useful. But the idea from an herbalist perspective is formulas can work. They certainly, especially if they're a well-made formula, but the problem with a formula or a compound product is you're now fitting the person to the formula rather than the formula to the person. And so as a clinician, I make up formulas for my patients individually, meaning, if they need a bitters formula and I have one that's already made up that's good, great, nice. But my favorite bitters formula I call DOPA. And DOPA stands for dandelion, orange peel, angelica, and artichoke, which are the herbs in it. And so I know of one brand that has a DOPA formula, but has peppermint in it also, which is fine for most people, except if somebody has GERD. If they have gastroesophageal reflux, peppermint's not a good idea because it makes it worse. So if the formula works and meets that person's needs and fits them, great. If not, then I want something that is actually formulated to fit the specific person that I am dealing with. And I think in most cases, that's where you're going to get the best results.
And so what you're saying basically is when it comes to these products, because most people can't necessarily find an herbalist. So how many herbalists are around the US? Typically if you had someone visit you, how long is your wait time? Do you have a lot of people? How many herbalists can service that many people across the US? And to the busy people out there, or to the people who don't want to necessarily pay for this service, you're saying that the products matter because they're transparent about their testing, or their the board members and how they formulated. And would that be enough if someone had an RH next to their name and having been formally trained to kind of, assume that product has been formulated properly? All of those questions.
Okay. Well, number one, if somebody has an RH next to their name, it means they've been through an extensive peer-reviewed process and they know what they're doing. And not only do they know what they're doing, but they understand, number one, their scope of practice, limitations of practice, and for the most part, they're going to be a safe clinician. This is somebody you can say, all right, this is somebody who's not just, because anybody can say, hey, I'm an herbalist. All right. But not everybody can say I am a registered herbalist with the American Herbalist Guild. So that's number one. Now, as to how many herbalists there are, I'd say clinical herbalists, there's probably a few thousand throughout the United States. There are areas where there's lots of them, like California. northern, northern New Jersey, Pennsylvania, a lot.
Oregon, I bet. Yeah.
Oregon, there's a lot of herbalists. There's also a lot of naturopathic physicians.
Yeah.
There are certain areas where there are a lot of herbalists, and then there are areas where there are probably none.
Right.
I've trained myself in my program. I've trained probably several thousand clinical herbalists. But yes, but again, there are other people who know herbs. Again, there are medical doctors who know herbs. There are naturopathic physicians who know herbs. Most acupuncturists are trained in herbs, not all, but most. So there are other people who are professionals who do have this knowledge to varying degrees as well. And the good news is more and more people are getting interested. On the other hand, it's still a smaller minority of people who are looking for an herbalist.
Can you do telemedicine with in other words, are there herbalists that will do this over the screen?
Yes. Yeah, there are.
Okay. So you don't have to actually come into an herbalist to actually have a full on, physical visit.
That depends on the herbalist.
Okay. Gotcha.
Some herbalists, may want to do, like if they're trained in Chinese medicine, they may want to do pulse analysis, in which case I just can't do that on the computer.
Right.
But yeah, there are many herbalists who do that. And what I would say to people is I think what it really comes down to is if you have a simple self-limiting condition, you have something like early stage benign prostatic hyperplasia, the swelling of the prostate that tends to occur in men as they get into their 50s and 60s. That's something you could attempt to treat. You can go to a store and get a good saw palmetto product, or probably even better, some saw palmetto with some nettle root and maybe some zinc and maybe a little bit beta-cytosterol. And this is a common product you're going to find, and you can try it. And if it works, fantastic. If it doesn't work, you either look for a clinician or you go to your urologist. If you have something like menstrual cramps or stress headaches or something like a simple osteoarthritis, which orthodox medicine doesn't really have very much to offer, sure, those are things you could attempt to treat yourself for. On the other hand, if you have something really significant, all right, you have something that's not a self-limiting condition, that is not the place. There's an old expression, the person who has themselves for a doctor has a fool for a physician. There are certain things you don't, even as a clinician, you don't treat family members because you cannot be objective when it comes to treating your child or your grandchild or your parent. And you also need to look at, is this a condition that is, potentially either life-threatening or a really serious condition. In the past, I've had people, call me up and they've got like AFib, atrial fibrillation. And I'm like, no, you need to go see a cardiologist. I won't even see patients who have that condition unless they're under the care of a cardiologist and the cardiologist is willing to talk to me. And, and I'll work or dealing with other stuff. I let the cardiologist deal with the AFib because you can die from AFib. You have somebody who has poorly controlled asthma.
Yeah.
So again, it is really important that everyone understands the limitations.
Yeah.
If you have somebody, and there are people out there, like the folk herbalists who say, oh yeah, cayenne, hot peppers can cure everything.
Yeah.
No, they can't, and
no, I like the reasonable approach of staying in your lane, understanding the extent of what your recommendations and even like renal physicians. I grew up with a dad who's a nephrologist, now my brother, and I'm thinking every time anyone wanted to take something, they were so worried. Even the doctors, they would always call the nephrologist, can my patient be on this, that, or the other? I mean, there's such a, siloing of even specialists with their organs and which ones could tolerate. But you're saying that the reasonable over-the-counter, soft stuff, so to speak, nothing that involves major chronic illness that's uncontrolled, diabetes that's uncontrolled, hypertension, cardiac arrhythmias, someone on dialysis, someone who has chronic kidney disease, someone who has chronic liver disease. That's not where you would really play around with herbals entirely unless you had really a team approach to that.
I think that's a
Yeah.
really smart, intelligent way to do something like that.
Hmm.
And, through, as I said, throughout my career, I've always worked with with physicians.
Yeah.
I love working with physicians because they know things I don't know. I know things they don't know.
Yeah.
I train physicians. I mean, but it's awesome because for some reason, also the last 15 years, I trained a ton of veterinarians, and I don't even work with animal medicine, but a lot of it they can take and translate into, working with your cat, your dog, whatever. The idea is that the whole siloing of things is really problematic to good health care.
I kind of agree. I will tell you that. And I think that the way you're saying it in such a judicious manner and, and understanding how there's a whole bunch of different things that can affect the quality of even what you're taking that have nothing to do with the practitioner. It's the processing, it's the manufacturing, it's the shipping, it's the packaging, it's all these different components that you can't always control for, but you can do your best through some very reasonable research, vetting out practitioners, vetting out companies, looking at their board members, looking at the people behind those products and those formulations is really helpful. Tell me something, Dr. Winston, David, what are your top 5 go-to herbs and for what what you like to use them for that most people would not have any problem with from a health perspective, being very, very safe? And, how have they been, very effective in your practice with your patients?
That is almost an impossible to answer question.
Ah.
It's a little bit like saying, "What is your favorite child?" The
Oh, I could
problem,
tell you. No, I'm just kidding.
the problem with that is, and sometimes I've been asked questions like that a lot.
Yeah,
You're at a conference and they say, "Well, what's your favorite herb?" And
right.
I'm like, "Well, for who and for what?" So the problem with that question for me is that I probably routinely use sort of maybe 400 to 500 different herbs, and then I know significantly more than that. But there's some that are really obscure and that I rarely use. So let me talk about very briefly just a couple categories of herbs that I think your listeners probably would be really useful to know about. And I'll talk about just 3 categories. The first category are adaptogens, and I've written a book on the topic. And adaptogens are, again, poorly understood. And that's one of the reasons I wrote the book, because I got tired of people calling herbs adaptogens that don't meet the definition of an adaptogen. The original definition was created in 1969 by a couple of Soviet researchers. And what most people think of an adaptogen is they says these are herbs that help you adapt to stress. And that's true. But in the intervening 50 some odd years, the definition of an adaptogen has grown in the sense that we now have a better understanding of what adaptogens do and how they work. So they work through, number one, 2 control systems in the body, one called the HPA axis, which is the hypothalamic pituitary adrenal axis, which is sort of the master control of all endocrine function, a great deal of nervous system function, immune function, male and female reproductive function, cardiac function, the gut brain, the enteric brain function, and more. And then another system called the SAS, the sympathoadrenal system, which is your fight or flight mechanism. And so they work by helping to moderate and re-regulate these systems that can be out of balance because of chronic stress, elevated cortisol levels, which could also come from obesity or blood sugar dysregulation. And so they are really useful herbs for dealing with stress, and we're living in a rather stressful times. So I think that those are really useful. Now, of the adaptogens, all of the adaptogens, there's only 8 or 9 of them that there's enough research that we can say with certitude they are actually adaptogens. So there's like 8 or 9, that's it. There's another 5 or 6 that I'd call probable adaptogens. We're just kind of waiting on some more research to kind of really show that they really are. And then there's maybe another dozen herbs that I would say are possible adaptogens, but the reality is the research stinks. And we can't base this on tradition at all, because the whole idea of adaptogens is not based on traditional herbal medicine. It's based on Soviet research starting in 1947. Yes, there are quote unquote nutritive, nourishing, rejuvenative tonic herbs in Chinese medicine and Ayurveda, but they are not necessarily adaptogens. Some of them are, some of them are not.
I use
Anyway,
rhodiola as my top one, and that I only been cursory, we learned a lot in our training program, but in terms of actually putting into use and that I feel comfortable with, rhodiola has been really good for chronic fatigue syndrome as a potential trial if it's a good quality and brand. There's ginseng, as you mentioned, there's ginseng, and I think it's American ginseng, I think more so than. But needless to say, these are like, moving quick and furious. So tell me, out of all the ones that you said pan down, which ones do you use the most and for what people?
Well, here's the thing. So let's say we have these 8 or 9 well-known adaptogens, well-researched adaptogens. They're not a one-size-fits-all phenomenon. So some of these adaptogens are stimulating. Some of them are calming. Some of them are heating. Some of them are cooling. Some of them are moistening. Some of them are drying. Some of them are deeply nourishing. Some of them are not. So in a sense, in order to use them really effectively, you have to understand them. You have to learn their personality. Just like, we don't make assumptions about people based on their, where they grew up or whatever. They may have a certain accent, but beyond that, we can't make generalizations. With adaptogens, so for instance, you mentioned rhodiola. Rhodiola is probably the most stimulating adaptogen we have, but it's not deeply nourishing. So if you're the kind of person that says, oh man, if I even have a tiny bit of caffeine after lunch, I can't sleep at night, rhodiola is not the herb for you. It'll keep people awake. Rhodiola is also extremely drying. So if you have any type of yin deficiency, dry mouth, dry cough, dry skin, dry eyes, vaginal dryness, lack of synovial fluid in the joints, rhodiola can make all of those worse. So rhodiola can be really useful, assuming that you're not giving it to people with any of those issues. And I do not give rhodiola to people who have bipolar disorder, because it can precipitate manic episodes. So one of my favorite adaptogens is Schizandra berry. And Schizandra berry, the Chinese name is Wuizi, which means 5-flavor fruit. And it has supposedly all 5 flavors, but the predominant ones are sour and turpentine. It won't win any taste awards.
Yeah.
And Schizandra is a calming adaptogen that does something really odd. Normally, when we think of like stimulants like coffee, caffeine, it leaves you feeling, stimulated but alert and focused. Well, Schizandra makes you feel calm, alert, and focused. And traditionally, it was used in monasteries before meditation because focused and alert are perfect, but calm.
Yeah.
Schizandra also has anti-asthmatic activity. It's hepatoprotective. And of course, let's not forget, it helps astringe a leaky gingate. You do not want a leaky gingate.
What's that?
All right. So in Chinese medicine, jing is the life force, and it's associated with seminal fluid in men, urine in women. And so a leaky gingate is, urinary frequency, somebody who has, they cough or laugh and little urine dribbles out or things like that. So that's a leaky gingate. Men with BPH, that's a leaky gingate. And it helps to astringe a leaky gingate. It is also profoundly anti-inflammatory.
Wow.
And so I like Schizandra a lot, partially maybe because I like it a lot for me as an herb.
As a
I
pill
like
or
that.
as an extra? Like how do you decide between taking a tablet, a pill, or an extra?
It can be taken as a tea, but again, most people are going to go, not so much. So it can be taken as a tincture, which is an alcohol and water extract. And there are also extracts available that would then be in a pill form. And as long as it's a well-made extract, that is fine. The challenge again, though, is here's an herb that's coming from China. And China has some pollution issues.
Yeah.
So because of that, unless you can guarantee, and you have to be really careful with stuff that says it's organic out of China. There is real organic herbs out of China, but not everything that is claimed to be organic out of China is. And if I'm getting herbs out of China, that becomes even more important because of the level of pollution in China. And remember, a lot of our herbs are coming out of China, India, and Eastern Europe.
Right.
These are all places that have pollution issues. Not to say
Right.
we don't have them here, but
Right.
they have significant problems with that. So sourcing becomes a really important point. Where are these herbs coming from? And if they are organic, who is certifying that they are actually organic? And again,
Right.
people are going, oh, this is too much trouble. So then let's say we decide to stay with something that's grown here in the United States, then something like American ginseng. And
Yeah.
American ginseng I like a lot because, and there's American ginseng grown in artificially under shade. I don't use that at all. What
Mm-hmm.
I use is organically woods grown ginseng. So it's grown in its natural habitat
Woods
in the
grown.
forest, but it's cultivated because ginseng in the wild is an endangered species and we want to leave it alone. So it's being grown in its native habitat, but it is being cultivated. They're not using lots of pesticides or herbicides. They don't need to because it's in its native habitat. You're not growing it as a monocrop. And American ginseng is especially indicated for people who are about 40 to 60, right in that age frame, where you've all of a sudden you started to notice that my friend Russell used to say, Russell was wise beyond his time. He said, when you're a teenager, you're immortal. In your 20s, you become a superhero. In your 30s, you become mortal. And at 40, the warranty wears off. And the first thing that goes is the eyes. He was so right on about this. And he was
Oh,
only
wow.
about 26 when he said this.
Oh,
Anyway,
geez.
so here you are, you're 40, you're 45, 50, 55, and all of a sudden you notice some age-related changes. Maybe it's your eyes. Maybe it's, when the daylight savings time changes one way or the other. It takes longer to deal with that, even that 1 hour change, let alone when you fly to the West Coast and you have a 3 hour time difference. Or you notice that you're more sensitive to cold, or you're more sensitive to heat. Or it used to be, you had a bad night's sleep, you could get up the next day and still go, 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 go. And now after a bad night's sleep, you're just like, you're on your 5th cup of coffee because you're just like, you are dragging. You're starting to notice that that's where American ginseng is beautiful.
Are there any
And
interactions with with medications at the ages of 40 to 60 that you can think of?
not very
Blood
much.
pressure medicines, nothing like
Not
that?
with blood pressure medicine. It does have some ability to lower blood sugar a little bit, not a lot. So theoretically, if somebody is taking, something like a metformin or glipizide or something like that, they might want to, keep an eye on their blood sugar just to make sure it's not getting too low. But honestly, I've never seen it do that. And again, it's not inexpensive, but you don't need to take massive amounts of it. So it can be taken, it's available as a tea, it's available as a tincture, it's available in capsules. And again, if it's organically woods grown, it's safe, it's effective. If you're on something like warfarin,
Be careful.
maybe not. Okay.
Yeah.
Although there are human studies showing that in small doses there was no interaction, but I'd run that by my physician before you just start taking it. But for the average person, it acts not only as an adaptogen, it is slightly stimulating, but not like Asian ginseng or rhodiola, but it's deeply nourishing. And it enhances immune function. It acts as what's called an immune amphoteric. So if your immune system is hyperactive, it helps to re-regulate it back to baseline. If it's hypoactive, it helps to re-regulate it back to baseline. And immune amphoterics are especially indicated for autoimmune diseases, which is
We like
something that
that.
doesn't exist in Orthodox medicine, this idea
Right.
of being able to re-regulate the immune function, overall
Right.
immune function.
Right.
It
But that,
also is really nice for people. For instance, you let's say this past winter you had RSV, or you had pertussis, or any number of other things, or you got pneumonia, and afterward you're left with this lingering dry cough. You've lost weight. You just can't get your energy back. Perfect in a scenario like that.
You are, I mean, honestly, you're a walking textbook, clearly. You probably wrote half the textbooks. You've trained half the, if not more, the herbalists that are sharing this wonderful information. And you really come from a place of extensive knowledge and understanding of the system and understanding of how to do this well. How can people learn more about the work you do and about actually resources? I was going to mention Sloan Kettering has this resource where it has medication herbal interactions. I want to know what your thoughts were on that resource, which I do give out to patients. I even have it on my website. I'm curious to know what online resources would help people make a safer decision about whether to try herbal medicine or from other practitioner recommendations.
Okay. So let's start with that, and then I'll get to me at the end. So the Sloan Kettering thing is okay, but is, let's say, cautious to the point of almost paranoia.
Okay.
There's a lot of things in there that are more hypothetical than based on reality. So it's not bad. It's just understand that they are erring on the side of caution to a significant degree. Maybe over erring on the side of caution. And a lot of the information that they're basing it on, quite a bit of it is based not on human clinical trials, sometimes not even animal trials, but in vitro studies. And in vitro material, when it comes to herb-drug interactions, almost never pans out. So I would just say, sure, look at it, but it's not the gospel, shall we say.
What others do you recommend?
Well, the one that I recommend, now there's an online version, certainly for physicians, is the Botanical Safety Handbook. And I'm one of the expert advisory committee who puts this together. This is the second edition, and the third edition we are working on now. And it'll eventually come out in hardcover, but it's available. We're constantly updating it. And this is the expert advisory committee is made up of medical doctors, pharmacologists, clinical herbalists. I mean, we have some of the best herb drug interaction researchers in the world on this panel. I mean, it is people who really know their stuff, and we go over everything in the literature with a fine-tooth comb, and we are looking at tradition. We are looking at science. We are looking at the level of science. We are looking at, whether this, is this a study that is based on actual, what somebody could do. I love these animal studies where they give doses that are so far exceeding what a human could possibly consume. You have to give a higher dose in like a small animal because their metabolism is faster. But if you're giving a dose that is like 30, 40 times what a human would get, then you've gone past that level. And again, it's like there was studies done back in the 1970s, talking about how sassafras was a carcinogen. It contained a chemical called safrole. And later, those studies were redone in the late 80s or early 90s, and they kind of looked at it and said, yeah, these studies are flawed. Well, part of the problem is most people, when they drank sassafras, drank it as a tea, and safrole is not really particularly water soluble. So the amount of safrole that people got for drinking sassafras as a tea was negligible, and the amount they were giving the mice was really high. And so, everything. Lima beans contain cyanide.
Right.
But
so
how many lima beans?
Everything is relative to the way in which it's set up. So you suss that out when it comes to some of the instructions in that text, which sounds like a thick, amazing book filled with wisdom. Is there an online version of that?
Yes.
Or and so people can access that by being a member, or is it something that they can access?
You can buy the online version. And again, it's the Botanical Safety Handbook. It's phenomenal. It is the single best piece of work out there. Again, the amount of time, energy, and the level of expertise that has put this together.
That's great.
Is
there an
really
app?
incredible.
Is
What?
there an app for people on the go who are on the go shopping and somehow want to look something up at the store? Is there any apps that you're aware of that
I
make
do
it
not
accessible?
know. I am so technologically incompetent.
Well, if you come
Maybe.
across one, I've seen a few out there. I just don't know if they're reliable. And
Yeah.
so that's why I use the Sloan Kettering, because I
Yeah.
know at least there's some thought behind it. And I will certainly put the link or if you can send me the link as well to that text
Right.
and how to reach that information. I think people would be very interested in taking what you've shared with us today and kind of playing around and poking around and certainly looking up what they're already taking, but even,
Mhm.
making better decisions as they move forward. And where can the audience reach you, or at least learn some of the work that you're doing and read about, things that you offer?
Okay. So my website is herbalstudies.net, and that is the website for my school, which is the David Winston Center for Herbal Studies. It's a 2-year training program in clinical herbal medicine with additional 3rd and 4th years. Half of my students are already medical professionals, a lot of physicians, a lot of acupuncturists, veterinarians, etc. But the other half are people who've often been self-studying herbs for a couple years to decades and want to take their knowledge to a higher level. Um, in addition, at that website, there are from my library, which is one of the largest private herbal research libraries in North America, there are books that you can download for free. These are all like old texts that are just amazing. They're all well out of copyright, that are just not easily available, although there's more sites like that now where you can get, everything from Google Books to whatever, where you can get that information. It also has information on where I'll be teaching next. So, for instance, if I am teaching someplace in your neighborhood, it'll say, hey, I'm going to be at this conference or, doing classes here. So that's all there. My book is it's called Adaptogens: Herbs for Strength, Stamina, and Stress Relief. Yes. That is available on Amazon or whatever. Although you can get it from my website, and if you get it from my website, I'll even sign it to you. So
Oh,
whatever,
nice.
I don't. You can get it wherever you want. But if you want to learn more about adaptogens and the herbs that work with them, what
Sure.
I call companion herbs,
Yes.
nervines, which are nerve tonics, which again work nicely with adaptogens for people who are highly stressed. That's also in there. I have an herb company, which I generally am not like wanting to promote products and stuff, but I'll just say that the name of the company is Herbalist and Alchemist. And I didn't start this company because I wanted an herb company. Back in 1980, when I started the company, I just couldn't get good herbal products for my patients. So I started making my own, and it wound up being a company.
Fantastic.
Those are really the areas, and if you want to try to contact me, you can go through the herbalstudies.net website. I will tell people I really am not taking new patients at this time, but we can refer you to people that I've trained,
Great.
and certainly we have people not only all over this country but around the world who have been trained in herbal medicine. And again, many of them are already health professionals. And so if there's somebody who is in your area or who's open to working with people, through Zoom or whatever, we're happy to help people
Great.
connect you up. And then I would also point out, this is not me, but the American Herbalist Guild has a website where you can find out, or if there are American or professional members in your neighborhood, in your area, who you can go see, especially again, if you have a more complicated situation. And I would say most of those people are also, if not all of them, they're well trained enough that you show up with a condition that is, something that's really you need medical professional help, not herbal help, that they're going to tell you, yeah, you really need to
Great.
see a physician for something like that. And that's one of the
That's
good things
awesome.
about having people who have been trained well enough to know, mm-mm, not for
Okay.
me.
That is that. I'll tell you, you have given us so many resources, so much information. I'm going to make sure that I share all of this in bulleted form as well when we promote the episode. And I'll be honest, I think this has been one of the most eye-opening conversations I've had in a long time because I didn't know a lot about herbology, right? Herbology and being an
Herbal medicine,
herbalist and herbal
herbology.
medicine, botanical medicine, botanical therapeutics. I think it's a really interesting world, and I know a lot of people are interested in it because, we've had a lot of people thinking about alternatives to even medications and bringing this into lifestyle. So it's been really eye-opening. Thank you so much, Dr. David Winston, for joining me. And reach out to him or check out some of our links that we will have for the show episode. So thank you for being here and spending your time with us.
Oh, Ailey, thank you so much. It's been an absolute pleasure. I've enjoyed speaking with you
Thank
tremendously.
you. Thanks.